Hello, I'm excited to present you my research, New Horizons in the Treatment or Prevention of Cystic Fibrosis-Related Diabetes. I'm Anca. I'm a fourth-year pneumology resident, medical resident in Bucharest, and a first-year PhD student, and Emeshe, Peter, Annette, and Jimin is my team. My research is driven by a vision. All cystic fibrosis patients' glucose metabolism is set to the best level we can achieve. For that, the mission is to find a therapeutic method which stabilizes glucose metabolism and also improves lung function. For that, I have two specific goals. First is investigating the effect of insulin therapy in cystic fibrosis patients, and the second one is investigating the effect of triple transmembrane regulator therapy on cardiometabolic parameters in cystic fibrosis patients. So let's move further with the first project, which is investigating the effect of insulin therapy in cystic fibrosis patients. Cystic fibrosis is the most common autosomal recessive disorder in Caucasian, and due to the increase in life expectancy of CF patients, previously rare complications are now coming to light. And the most common of them is cystic fibrosis-related diabetes, which affects 40 to 50% of CF adults. Diabetes is associated with increased morbidity and mortality, and in cystic fibrosis, one of the most important factors that determine patient outcome is lung function. So my aim is to investigate the effect of insulin therapy on lung function in CF patients. For that, a clinical question was born. What is the effect of insulin in cystic fibrosis on lung function? We use PICO framework. The population will be cystic fibrosis patients receiving insulin, and we will look at lung function and BMI before and after therapy. My hypothesis is early glycemic control with insulin improves lung function and quality of life in cystic fibrosis patients. A clinical implication would be administration of insulin in cystic fibrosis patients can increase survival and improve quality of life. For that, we conducted a systematic search with two domains. First one refers to the cystic fibrosis, and the second one to the intervention, which is insulin. We will look on all types of insulin and any regime. There is a systematic review done, but it's not a meta. For that, I have found through at least 3 key articles. They're all looking at CF patients, and they give insulin glargine, and they measure BMI and FEV1 before and after therapy. We conducted research in 4 databases, and after the duplicate removal and with my pairs are now at 97 articles with a Cohen kappa of 0.88. So this is the first project progress. We are on a full text selection. For the second one, I'm going to investigate the effect of triple transmembrane regulator therapy on cardiometabolic parameters in cystic fibrosis patients. Cystic fibrosis is the most common genetically lethal disease in Caucasian people. So for the most common mutation globally, which is this one, the standard of care from 2020 is this triple therapy, shortly ETHI therapy, which on lung function and BMI has incredible results. But a significant weight gain was observed, and now 90 to 25% of people with cystic fibrosis are now classified as overweight, and 6.6 to 11% as obese. This starts a vicious circle because they develop derangements of glycemic and lipid control due to increasing weight and age. And by the age of 40% of people with cystic fibrosis will develop cystic fibrosis-related diabetes. Some studies shown that 60% of people with cystic fibrosis had hypertriglyceridemia, and this leads to increase in blood pressure. And in 2021, from the Cystic Fibrosis Foundation patient registry, we know that 7.2% of these patients are now classified as having hypertension. So my aim is to investigate if ETHI therapy has an effect on cardiometabolic parameters and slow down this vicious circle. For that, I have a clinical question. Does ETI therapy have an effect on cardiometabolic parameters in CF patients? The population will be, of course, cystic fibrosis patients. We are looking on these parameters: BMI, weight, HbA1c, blood pressure, cholesterol, and triglyceride. And we will look before and after therapy. My hypothesis is ETI therapy may increase the prevalence of cardiometabolic parameters. And this will be important because in the context of longer survival and increased prevalence of overweight, it is thus important to assess cardiometabolic risk. We've conducted a preliminary search with the domain, and there's no meta done in this topic. We have at least 3 articles for every parameter mentioned, and this is an example for weight and BMI. As you can see, there are a good number of CF patients that are measuring BMI and weight before and after ETI therapy. So, to summarize, in the era of modular therapy, insulin is still the standard of care for cystic fibrosis-related diabetes. As the medicine advances, we have to be aware of the effects of the new therapies and also provide data for more accessible one for those who don't have access to the latest therapies. And I will close my presentations with the words of Nelson Mandela: "It's always impossible until it's done." Thank you.
So insulin administration can come with some challenges. I'm just wondering, have you considered oral antidiabetics?
Yes, actually, I want for this to be my third project because in the current guidelines, insulin is still the standard of care, and they are saying that oral antidiabetics don't have a greater effect than insulin. But I found some really good articles and new articles that are looking on the oral antidiabetics, and I think this can change the guideline, or this would be a very interesting topic for clinicians to know if they can give oral antidiabetics to these patients.
Regarding the second project, you were talking about the prevention of diabetes, and I was thinking what you should do in the pre-diabetes stage in cystic fibrosis in the patients you have seen in the articles you search for.
Actually, the pre-diabetes state for my first project is the most interesting part of my topic because I will do subgroups with them. And actually, the 3 key articles I've shown you, they are giving insulin to the pre-diabetic patients. And basically, it's not a prevention of diabetes, it's a prevention of lung function deteriorating and BMI deteriorating. So, yeah, that's what I want to do with pre-diabetic state. We want to know if we can give insulin in that state.
Thank you.
Thank you.
Thank you very much for your nice presentation. I have a question that is there any difference between the treatment of children and adult patients?
No, it's not. They're giving the same therapy.
Thank you. Congratulations. I would like to ask that this triple transmembrane regulator therapy is very new, if I'm right. And my question would be that it's widely accessible in worldwide, or who can get it?
Thank you for your question. It's a very, very, very expensive therapy, and as far as I know, only UK and Ireland and US, because they have a private healthcare system, they can provide these therapies for these patients. So that's why I want to look in every option, like insulin, oral antidiabetes, and of course in the new therapies. So integrate them all for everybody to have access to treatment.
Thank you.
Congratulations on your presentation. Since more or less is your topic is related to my topic, periodontitis and actually diabetes, what is the how about hypoglycemic events in administration of insulin in pre-diabetes phase, and how would you cope with that and manage it? Thank you.
Thank you for your question. Actually, in the pre-diabetic phase, it's only the dose of insulin is very low, so it's the hypoglycemic events, they are not very presented. But the hypoglycemic events in cystic fibrosis-related diabetes is no different from the other types of diabetes. So it's closely related to the dosage of insulin, the diet, and exercise. So it's nothing special there.